So my research interests are all around virtual reality. I have a passion to understand how we process the world around us, so how our mind deals with the world around us, how we perceive things, how we attend to things, but in particular when we're using a little bit of kit like the kit I've got to my left here, which is our Oculus headset, which we make use of, Oculus projects largely in our labs, to try and determine how, when you pick up something like this and you put it up to your eyes, how that then transports you into another world. So really what we're doing here when we're putting a headset like this over our eyes and we're exploring the sort of digital world that's created for us, is our mind is processing that information and giving us a sense that we're there. It's something that we call presence, but it's this idea that we're immersed within an environment and we have this genuine feeling that we feel like we are there. We run some really tight experimental studies where people are putting their hands in freezing cold water and seeing how long they can keep those in, and then they're putting the headset on and trying to do the task again, and we're seeing how long they keep their hand in there. And you think that might sound like a bit of an odd experiment, but what we're looking at is a thing called pain tolerance. So pain tolerance is how long you can tolerate pain, as you might well expect, and is relevant to lots of different scenarios. So whether you're having dressings changed in the hospital, whether you're going through labour, whether you're going through some sort of surgery, there's lots of instances where we have a need to tolerate pain, and we usually do that with an anaesthesia. But what it turns out is that actually using a virtual reality headset, so looking around, being part of a virtual world, allows us a form of anaesthesia without the sort of addictive properties or the potential medical complications, because we find that people can tolerate more pain, they can tolerate higher intensity of pain, and generally what we're finding is that these things can be particularly useful when it comes to pain management in general. However, these things seem to differ a lot from individual to individual. So what we're really interested in the research that we're doing here is how we account for those individual differences. So what we're doing in our labs, and with the help of our students, so we integrate this into our third year projects. So I always have third year project students who are involved in projects like this, often take on students as researchers, so students being paid as research assistants to run these sorts of projects as well. I know the students that get involved enjoy it, and they all leave with a sense of having learnt a little bit about this technology that in theory in 5 to 10 years time may well be popping up in hospitals and doctors around us all, and it's kind of a slight race against time to make sure we have the best understanding we can about how these things work before they begin to get rolled out in a big way. And if you want to learn more about all the kind of stuff that we're doing, then look at the links in the description below.